I started getting involved into the sleep apnea treatment, the dental treatment of sleep apnea, about 3 years ago. But the obstructive sleep apnea is when you're asleep, the airway over here will start to collapse and the patient will stop breathing, start with snoring, and then they'll stop breathing. This is a treatment for only obstructive sleep apnea. I've been using the same type of appliances, and there are different models for it. They're custom made. We've been using them to treat snoring for the last 15 to 20 years. They've only been approved to treat sleep apnea by Medicare and the FDA about 3 years ago. The appliance, instead of keeping the pressure on the airway to keep it open, it uses the biomechanics by advancing the jaw a little bit forward, and that will open up the airway right on top of the voice box, which is where the obstruction usually happens. It looks like an athletic mouth guard, one for the top teeth and one for the bottom teeth, with the contraption in between the two to hook it up together. And it basically keeps the mouth semi-closed and your lower jaw a little bit forward. And that will open up the airway over here, and the patient can breathe on their own while they're asleep without needing a machine. It's not cumbersome. It does not limit the movement. It gives the same type of results as the CPAP machine. And usually people are not allergic to the material that it's made out of. With the mask, there is some type of mask that the patient will have allergies to. It's very claustrophobic, it's very cumbersome, and it limits the movement of the patient. And some people, they just cannot use it. It's very successful treatment, and it's been used for many years, and it's usually the first line of defense. If somebody cannot use CPAP machine for any reason, that's when the oral appliance treatment is recommended by the physician. It's usually successful in about 60 to 80% of the situation, and we can improve the airway opening by about 50 to 80%. It's not a treatment for everybody, but it's very successful.